The History of the International Society of Dacryology and Dry Eyes, ISD-DE. Why am I giving this talk? Well, I think it's because I've always been interested in dry eyes and watering eyes. I trained at Moorfields Eye Hospital, and I was very fortunate to work with Roger Buckley, Peter Wright, and John Dart. And we would be looking at very small minutiae of the lid margins, eyelashes, tears, and meibomian glands. I then became an ocular plastic surgeon, training with Richard Collin, and I developed an interest in lacrimal disorders, running the lacrimal and ocular plastic service at the Western Eye Hospital, and writing an original book called Colour Atlas of Lacrimal Surgery. I'm now in private practice at Clinica London, and I find that about 60% of my work is medical, to do with watering eyes and dry eyes, and about 40% is surgical, eyelid surgery and tear duct surgery. I hope that your meeting takes us forwards on the frontiers of ocular surface dry eyes and dacryology. The Greek word dacryology, seen here in different languages. Dacrya means tears, and dacryology is therefore the science of tears. What does the word tears mean? It's an old word, a tear, a drop, or a nectar. I love that term, a nectar, because it contains so many good nutrients. Lacrimal is an adjective, again, a very old word. We have lacrimal duct, lacrimal system, lacrimal unit. Therefore, dacryology is about both tears, wet and dry, their production, how they function over the surface, their constituents, and how they drain. All of that is encompassed in dacryology. In 1981, Juan Murabi de Castilla of Madrid wrote Dacryologia Básica. He laid the basis for what was originally called the International Society of Dacryology, which was officially founded in 1982, concerning the science and clinical practice of watering and dry eyes. It was truly an international society, with its founders being from Spain, Hungary, USA, and Sweden, and they prepared a 12-page constitution. This is a little outdated now, and one of my jobs as president of the International Society of Dacryology and Dry Eye will be to work with the committee to update the Constitution of 1982. So the International Society of Dacryology concerns the ocular surface, tear constituents and quantity, eyelid function, and drainage. It set out to hold triennial meetings, with the first one being in the USA, then in Hungary, then in the Netherlands. The fourth one being back in Spain, well, in Spain, by its founder, with an extra event in Toronto as a spin-off to the International Congress of Ophthalmology, the ICO, organised by Jeff Hurwitz. Then it continued with a meeting in Sweden, a meeting in Jerusalem, and a meeting in New Orleans. We get to 2005, which was a pivotal year for ISD, because at that meeting, they opted to link the dry eye people with the watering eye surgeons. And they became ISD and DE. And I found an interesting reference in Optician Online, which I'll show you next, written in 2005. It's well worth searching this out, where they outline what the aims then were for the International Society of Dacryology and Dry Eye. And those are aims that we continue with today, especially as so many people are getting problems post-COVID and with so much screen use. This is their original logo, which we will develop further. Then there was a meeting in Turkey, and this was the first meeting I went to, organised by Suat Urgabas. It was a networking as well as scientific meeting. It's an opportunity, these meetings, to meet our international colleagues, as you are doing now in Singapore. Then Ray Javati held the meeting in the Philippines, where he was the president, and he even got the president of the Philippines to attend his meeting. But also it was an inspiring meeting, because we have to thank Ray Javati for helping us to take forward the society. Being every 3 years and very much an informal society, it depends on the loyalty and energy of the people involved. Lelio Baldeschi organised the meeting in 2014 in Naples, along with the Italian Society of Oculoplastic Surgery. And here are some familiar faces. Mohammed Javed Ali in the front row, as is Ray Javati. And here we are on now to the 12th meeting by Nikos Trakos in Athens. And the picture in the middle, I am in it because at that meeting they elected me to become the next president. On the right, you've got Lelio Baldeschi and Ray Javati, two ex-presidents, chatting seriously about some aspect of watering or dry eyes. And here is the team in Athens with, again, many familiar figures. Nikos Trakos was a tremendous president and host, and we all enjoyed the meeting. And the AGM elected me to do the meeting in 2020. That was all organised and everything was set up to go for June. But in March 2020, goodness, time goes by. No, was it? Yeah, it started, COVID was started in November 19, but the impact with lockdowns came in 2020. And alas, this meeting was closed. And it was further delayed because of lockdowns from COVID-20. And yet there is a tremendous demand from doctors and patients for clinical research and treatment of watering and dry eyes, extending not only from adults, but into adolescents and children. We're really recognizing the importance of ocular surface health and comfort. There are many triggering factors, or what I call aggressors, for uncomfortable sore watering eyes, which may sometimes be manifested as dry eyes. Certain surgeries can bring on uncomfortable dry eyes, which can have periods of watering. We know that refractive and intraocular surgery are triggers or aggressors, and certainly excessive screen uses, air conditioning, indoor living, central heating, diet, lifestyle, cosmetics, and a feeling of anxiety, which many people have had over the last couple of years. Then there are people who are predisposed, such as those with rosacea and contact lens wearers. So we couldn't have the meeting in 2020, and we've opted to have a time of reflection and planning and to hold the meeting in 2024 in London. I'm naming that year the Year of the Tear. I want to work with the committee and you, the members, to continue to unite the oculoplastic lacrimal community with the ocular surface corneal external eye ophthalmologists. We are going to develop the website further, rewrite the constitution, and give it a sound financial basis and organisation. The emphasis is changing. Watering eyes are not all about whether a patient is going to end up with a dacryocysto-rhinostomy. As I've already said, I'm seeing a lot more patients with ocular surface disease, and I'm astounded by how often I am still being referred patients for DCR, in whom I examine them and I find that they do not need DCR, but in fact they need medical eyelid and ocular surface treatment. We are all getting a better understanding of ocular surface inflammation. There are new syndromes coming out like chronic ocular surface pain, ocular surface neuropathy, new treatments with growth factors and the use of cyclosporin, Blefex treatments, and more recently, Optilite IPL. And we are educating patients to take charge of their own eyes. Here is myself with my IPL machine and my glasses to protect my eyes from this broad light. So ISDDE is here for the science of tears. It unites ophthalmologists, optometrists, contact lens opticians, and provides patient information. 2024 is going to be the year of the tear, and I welcome you all to the meeting in London, which will be the 14th meeting. We will not have the 13th. We're also, with many members of ISDDE, preparing our book, which is currently being edited by the various editors here, that will be out in 2023-2024. This is the website address. Please look at the website, become a member, become involved, and take us forward in the field of watering and dry eyes.